Next case. A lady underwent vaginal hysterectomy. A lady underwent vaginal hysterectomy. Okay, fine. For carcinoma cervix. Okay. Following the surgery, after her urethral catheter was removed, she complained of urinary incontinence. Oh, mar gaye. Vaginal hysterectomy for carcinoma cervix, catheter removed, urinary incontinence means dribbling of urine. On examination, she had normal voiding as well. Normal voiding as well as continuous incontinence. Methylene blue dye was instilled in her bladder through her urethra. After some time, her pads were checked and it showed yellow staining at the pads, but none of the pads were blue. She is likely to have. A lady underwent vaginal hysterectomy for carcinoma cervix. Fine. Catheter was removed. Complaining of urinary incontinence. Normal voiding as well as continuous. So, normal voiding as well as continuous incontinence. What is happening inside? Let us have a look. None of the pads were blue. She is likely to have. Last line is she is likely to have. Means examiner is asking diagnosis, not the management. Question is about diagnosis. Uretrovaginal fistula. Yes. In uretrovaginal fistula, what happens? Normal voiding as well as continuous incontinence. Yes, it is likely. It can be the answer. Yes. Let's have a look at other options. We will not mark it unless we see all four. Vesicovaginal fistula. In vesicovaginal fistula, can she go for normal voiding? She is going for normal voiding also. So vesicovaginal fistula is gone. In vesicovaginal fistula, she doesn't feel an urge to go for micturition on her own. Urethrovaginal fistula. There is dribbling of urine through vagina only at the time of micturition. Here it is continuous dribbling, continuous incontinence. Vesicouterine fistula. What happens in vesicouterine fistula? Menuria, hematuria at the time of menstruation. So this is also gone. So you are left with the answer uretrovaginal fistula. Very simple, chocolate question. Just cooked, just twisted the question little and the answer is uretrovaginal fistula. What is the most common fistula? Vesicovaginal fistula. Most common is vesicovaginal. Most common cause of vesicovaginal fistula in developing country, obstructed labor. In developed country, simple hysterectomy. Total abdominal hysterectomy or simple hysterectomy. Which one is the overall most commonly performed hysterectomy in the world? Total abdominal hysterectomy. We have written it in our PDF which I have given to you in your WhatsApp group and we discussed on that day also. Most commonly performed hysterectomy in the world is simple hysterectomy, which is also called total abdominal hysterectomy. And most common cause of vesicovaginal fistula in developed countries is this simple hysterectomy, which is also called total abdominal hysterectomy. What is the most common cause of uretrovaginal fistula? Verdine hysterectomy. Most common cause of urethrovaginal fistula, although it is very rare, urethro, fall from a height on the floor. What are the causes of menuria, vesicouterine fistula and endometriosis of urinary bladder? What are the surgeries for vesicovaginal fistula? Chesser-Moyer repair, Let's Go repair, Layer repair. For uretrovaginal fistula, Boari-Flap repair. What is the timing of surgery for vesicovaginal fistula? If it is diagnosed within 24 hours, immediate repair. If not, then at least after 6 weeks to 3 months. Uretrovaginal fistula is repaired immediately because it is diagnosed at the time of surgery. There is a cut in ureter. Fine, beta. So you have to remember name for uretrovaginal fistula, Boari-Flap repair. For vesicovaginal fistula, Chesser-Moyer, Let's Go, Layer repair. What is the most important aspect in pre-op management of vesicovaginal fistula? Urine culture sensitivity. Best route for urine culture sensitivity is ureteric route. What is the most important aspect in post-op management of vesicovaginal fistula? Continuous catheterization of urinary bladder for 2 weeks. Rule of 2. No per speculum per vaginal examination or intercourse for 2 weeks. No pregnancy is allowed for 2 years. If she becomes pregnant, baby is taken out by cesarean section. Which cesarean section? Classical cesarean section, also called upper segment cesarean section. Very important MCQ beta. Most important aspect in post-op management of vesicovaginal fistula is continuous catheterization of urinary bladder for 2 weeks. Most common cause of rectovaginal fistula, complete perineal tear. Most common cause of complete perineal tear, occipito-posterior position. Management, initial colostomy followed by repair after 3 months. Fine. Now,